Hello everyone, my name is Jon Turvey. I'm an NHS psychiatry doctor with over a decade of clinical experience and CEO and founder of SimFlow.ai. My talk today is called Stop Treating Communication as a Soft Skill, how AI makes it trainable at scale. I'm going to start with 3 real stories across healthcare, policing and schools, because they show the same underlying issue. Communication is treated as soft, but it behaves like critical infrastructure. Then I'll show why traditional training hasn't scaled, what AI changes, I'll do a short live demo to show it working, and I'll finish with a practical rollout playbook. First story, healthcare. Martha Mills was 13. She deteriorated with sepsis, and her parents repeatedly raised concerns. Escalation didn't happen in time. The national response is Martha's Rule, a route for families and staff to request urgent review or a second opinion. NHS England announced 143 hospital sites to roll it out in its first year. My point isn't to relive a tragedy. It's this. Communication isn't a soft skill in healthcare. It's safety critical. And when communication fails, escalation fails. Policing. In Norfolk, a 999 call was made where the caller said he'd lost the plot and had a knife. The handling and escalation of that call was later scrutinised, with misconduct proceedings reported, and 4 people were found dead after a subsequent response. Again, this point isn't sensationalism. In time-critical public services, communication determines what is recorded, what is escalated, and what action is taken. That can change outcomes very quickly. Bruce Perry, a head teacher who died by suicide following an Ofsted inspection. A coroner issued a prevention of future deaths report and found the inspection did not contribute to her mental health, deterioration and death. Responses followed from Ofsted and government. This is a different kind of harm, but it's still harm. Communication doesn't just affect outcomes, it affects psychological safety, performance and retention, and that matters enormously in a workforce crisis. So different sectors, but the same failure mode. High stakes, time pressure, emotion. Critical information gets missed or not escalated. People experience interactions as dismissive, unsafe, or punitive. The cost appears as harm, complaints, rework, wasted time, and burnout. That's why I say communication is the operating system. It's the glue that holds service delivery together. Here's the uncomfortable truth. Communication skills are still undertrained, not because leaders don't care, but because the training model hasn't worked. We often rely on one-off workshops, variable teaching quality, and minimal deliberate practice, and we rarely measure improvement properly or provide consistent follow-up. The reason is what I call the modality trap. The most effective training is high touch, coached role play and simulation, but that requires actors, faculty time, rooms and diaries. It's expensive and hard to schedule, so it never scales to the whole workforce. Provision becomes patchy, people don't get enough reps to actually improve. So if we want to train communication at workforce scale, it needs to look like infrastructure. It must be repeatable, realistic, measurable, low friction, and supportive, with psychological safety and educator oversight. If it needs rooms and calendars and administrative staff, it won't scale. This is where AI simulation becomes powerful. SimFlow.ai provides remote voice-to-voice simulated conversations with patients, relatives, colleagues, students, any interprofessional conversation on demand. Feedback can be aligned to rubrics with audio playback for educators and facilitators. It's built for high-risk conversations, complaints, de-escalation, safeguarding, handover, and we're seeing evidence signals too. In GP training evaluation work, conversational AI showed strong acceptability and reported up to 84% cost reductions compared with traditional methods. At this point, the best way to explain it is to show it. I'm going to do a 3 to 4 minute live demo within a school setting. Bear in mind, I'm a psychiatrist by background. As you listen, watch for two things: empathy and structure under pressure. And count whether I summarise, check understanding, and make next steps explicit. Amira Eliza Jones, a 13-year-old student at Wellingdale Academy in Northampton. She's quietly approached a staff member in the pastoral office, asking to speak in private. Amira is withdrawn, anxious, fidgeting, avoiding eye contact. She hints at worries of her home life, mentioning feelings of fear and a sense of responsibility that seems unusual for her age. Our task is to engage Amira in a sensitive conversation, to explore her concerns and gather information, using open-ended supportive questions to gather relevant information about her emotional well-being and home situation, while building trust.
I just don't feel right. Like, stuff at home, it's scary sometimes.
Okay, well, thank you for sharing that with me, Amira. My name is John. Could you kind of just see if you can share a little bit more detail with me as to what's going on at home?
I don't know, it's probably nothing. I just, sometimes at night it gets really loud, like shouting and stuff. I just get scared, I guess. My little brother, he gets really upset. So I try to stay with him. I'm sorry, I don't want to get anyone in trouble.
Okay, so you're not going to get anyone in trouble for kind of sharing information with me. Kind of whatever we talk about in this room does kind of stay confidential, unless I have to kind of share that if someone's particularly at risk. But we can explore that in a little bit more detail if needed. So tell me, you've mentioned your younger brother Malik at home. Who else is at home with you?
It's just me, Malik, my mum, and Daniel. He's my mum's boyfriend. He moved in last year. It's just, since then it's been like different. I don't know. I just feel like I have to look after Malik all the time now. Mum tries, but when Daniel's angry, it's just really hard.
Okay. And how long has that been going on for now? You said kind of your mum's boyfriend moved in about a year ago.
Yeah, like it started not long after he moved in. At first, it was just like arguments sometimes, but now it's most nights, especially if he's, had a drink or whatever. It's just, I don't know, it feels normal now, but not like good normal. Sorry, I don't know if that makes sense.
Yeah, no, whatever language you feel comfortable using, I'm able to follow that. Thank you for sharing this. This must be kind of quite uncomfortable, and it sounds really quite scary for you. Is there a particular kind of part of what's going on at home that you'd like to focus on more? Is there any specific elements you'd like to share?
I guess it's just when he gets really mad. That's when I get scared the most. Like sometimes he shouts so loud, and sometimes things get thrown, like plates or stuff. I always try and get Malik into our room and just like shut the door. I don't really know what else to do. I just don't want anyone to get hurt or anything. Sometimes I just stay up to make sure Malik's okay. I get worried if I fall asleep and something happens. I don't know. It's just a lot.
Yeah, it sounds really, really a lot for you. Um, have you had a chance to speak about this kind of with anyone else, or is this the first time you're sharing this?
No, I haven't told anyone. I didn't really want to. I don't want to make things worse. I thought maybe if I just looked after Malik, it would be okay. but it's not really getting better. I don't know what to do anymore. This is the first time I've said anything. Please don't tell my mum, okay? I don't want her to be upset with me.
The key is that good communication becomes concrete. We can train openings, rapport, and agenda setting. We can train structure, signposting, and summarising. We can train empathy, naming emotion, validation, and using silence well. We can train risk, escalation language, safety netting. And we can train closings, shared plan, and understanding checks. This is the shift from be better to specific micro skills that people can practice and improve. This is also why AI isn't just more e-learning. Content doesn't create performance, practice does. People get better through reps, feedback, reflection, and trying again. AI makes the reps cheap and available. Educators make them meaningful. My rule of thumb, AI scales practice, humans ensure judgment. Where does this apply? Almost anywhere communication matters, and that's most public services. Induction, CPD, remediation, complaints and de-escalation, safeguarding, handover. It can also support recruitment and remote assessment using scenario-based screening. And it's already used across universities internationally and NHS trust settings within the UK. Here's a practical 90-day rollout approach. Start with one high-risk scenario, maybe a big local complaint. Define what good looks like, 4 to 6 behaviours. Pilot with a cohort. Baseline attempt, repeat attempt, reflective review. Measure confidence and behaviour change, and do light educator sampling. Then embed it into induction or CPD so it becomes routine. And avoid pilot purgatory by deciding adoption criteria up front. So I'll close where we started. Healthcare, police, schools, different sectors, same truth. Communication is the operating system. AI changes the game by making practice available, feedback consistent, and improvement measurable at scale. If you'd like to consider innovative ways to improve your organisation's communication skills, I'd love to connect. Thank you for your time.